In this video, I'll be breaking down the cost of knee replacement surgery. The cost can range anywhere from $10,000 all the way past $100,000. And in the United States, it averages between $30,000 and $50,000. The biggest factors affecting the cost are going to be where you live, specifically the country that you're in, the state or province that you're in, and of course the city that you're in. The next breakdown is between the people that are directly involved in the surgery and indirectly. And by directly, I mean the people that are in the operating room. So those people are going to be your surgeon, of course, the nurses assisting the surgeon, any nurses' aides, physician's assistants, nurse practitioners that are in the surgery room. There's also going to be people that are specialists in the hardware involved, the surgical representatives, because they need to have a bunch of different options available just in case the surgeon makes a last minute change. You don't want to have to hunt down that piece that they need. And of course, you have an anesthesia team, which is so important so that you're not awake during the whole process and you're not feeling everything that's being done. In any given knee replacement surgery, there may be over 10 people in the room besides the patients, of course. Sometimes there's training staff, there's doctors that are in training, there's people that are observing the surgery. All of this, of course, is controlled. Everybody's got to wear sterile gowns and all the equipment necessary. And people that are not actually working on the patient are nowhere near the patients. People that are indirectly involved are going to be your administrative staff that handle all the paperwork, getting you set up to have a surgery, and after the surgery there's paperwork that needs to be done as well. There's going to be billing staff that needs to talk with the insurance company or whoever's paying for this procedure done, because they need to have certain language that the insurance company talks to make sure everything's covered. There's also staff handling lab work and imaging like x-rays and MRIs. There's staff that's in charge of getting the supplies ready for the surgery before, and of course cleaning the surgery up afterwards. Some staff is also dedicated towards making sure the machinery used in surgery is operating well. They have to maintain that stuff. Then there's also cleaning staff that's super important to make sure that the whole facility is sterilized leading up to the surgery and of course right after the surgery. And after the surgery is complete, you'll likely need physical therapy treatment to make sure that your motion's coming back and you're getting back to walking. You'll encounter a therapist in the hospital once you wake up, and of course nursing staff as well. There's the bed, there's so many things that you're going to be using in the recovery. And then for months after the surgery, you're likely going to be attending physical therapy, and they've got their therapists, the assistants, the aides, and associated administrative staff with the physical therapy clinic. Now there are other costs associated with the surgery, like the health record systems that all the staff has to use to document everything that's going on to make sure that they have records. There's also medications that you're going to need to take after the surgery, the pharmacist that has to prepare the medications for you. There's a cost to the facility, the surgery operating theater. There's rent that needs to be paid. There's also utility costs, like of course your phone, your electricity, water, internet, and other utilities that might be needed to make the facility operational. And something that often goes overlooked is security. Hospitals often have security guards to protect the patients inside and everybody else working at the hospital, because the last thing you want is someone doing something that they shouldn't in the middle of your surgery. So you need that security service there. There's typically also marketing and advertising costs that a surgeon or a hospital might be incurring in order to get the word out that they're doing these kinds of surgeries. Now, did you know that in most cases it's possible to avoid a knee replacement surgery? In fact, we talk a lot about it here on this channel. There's a playlist down in the description below called the Knee Arthritis Help Playlist. And if you've already had a knee replacement and you're looking at getting another knee replacement, a revision, we've also got a playlist for you of specific videos for that situation. It's called the Knee Replacement Help Playlist. You can find that in the description below. I've also got some online programs that are linked in the description. There's the Knee Arthritis Recovery Program and the Failed Knee Replacement Recovery Program that I've linked for you in the description below. Hey, if this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to hear this. And don't forget to subscribe and turn on our notification bell so that you don't miss out on any of our helpful videos. Thanks so much for watching. I'll see you in the next video. Bye-bye.